Hello, everyone. My name is Mr. Brain, and I am the undisputed Commander in Chief, supercomputer, and CEO of your entire body. I sit safely protected inside the hard, bony vault of your skull, cranium, floating in a specialized cushioning fluid. I weigh only about 3 pounds, but I consume a massive 20% of your body's total oxygen and glucose supply because I am constantly firing electrical signals. In your nursing lectures and clinical rotations, you will hear me refer to using root words like encephalo or cerebro, like encephalitis, cerebrospinal fluid, or cerebrovascular accident. If you see those terms, it's all about me. My main mission is to process every single thought, memory, emotion, and physical sensation you experience while simultaneously controlling your breathing, heart rate, and temperature without you even having to think about it. Anatomy, the three major divisions. To pass your neurological nursing assessments, you need to understand my three primary geographic divisions: the cerebrum, the cerebellum, and the brainstem. 1. The cerebrum, the thinking cap. This is my largest section, taking up about 85% of my total weight. It is split right down the middle into a left hemisphere and a right hemisphere, connected by a thick bridge of nerve fibers called the corpus callosum. Critical nursing concept. My hemispheres practice contralateral control. This means the left side of my cerebrum controls the right side of the body, and the right side controls the left side of the body. If your patient has a stroke on the left side of their brain, the physical weakness will manifest on their right side. The outer layer of the cerebrum is called the cerebral cortex, gray matter, and it is mapped into four distinct lobes, each with a highly specialized job. Frontal lobe, the executive suite. This controls personality, reasoning, judgment, concentration, and voluntary motor movement. It also houses Broca's area, typically on the left side, which manages the motor function of speech production. Parietal lobe, the sensory hub. This interprets touch, pressure, pain, and temperature sensations from the body. It tells you exactly where a physical sensation is coming from. Temporal lobe, the audio and memory center. This processes hearing, smell, and memory retrieval. It houses Wernicke's area, which is responsible for understanding and interpreting language. Occipital lobe, the visual processing plant. It takes raw visual inputs from the optic nerves in the eyes and translates them into shapes, colors, and recognizable images. 2. The cerebellum, the acrobat, located at the very back of the head, underneath the occipital lobe. It is often called the little brain. What it does, the cerebellum coordinates voluntary muscle movements, balance, posture, and spatial orientation. It ensures your movements are smooth and graceful rather than jerky and clumsy. Nursing. Example: when you ask a neurological patient to touch their finger to their nose or walk in a straight line heel to toe, you are directly testing their cerebellum. 3. The brainstem, the lifeline. The brainstem sits at the very base of the brain and connects directly to the spinal cord. It is made of three parts: the midbrain, the pons, and the medulla oblongata. What it does. This is the most primitive, vital part of me. It controls automatic, involuntary, life-sustaining functions, your respiratory rate, heart rate, blood pressure, swallowing, and vomiting reflexes. Nursing emergency. If a brain injury causes massive swelling, the brain can push downward through the opening at the base of the skull, herniation, crushing the brainstem. This is rapidly fatal because it destroys the body's autonomic control centers. The guardrails, protection, and fluid dynamics. Because I am incredibly delicate, I have built-in armor and security systems. 1. The meninges, the three wrappers. I am wrapped in three protective membrane layers. Dura mater, the tough fibrous outermost leather layer. Arachnoid mater, the web-like middle layer. Pia mater, the delicate thin inner layer that hugs every curve of my surface. 2. Cerebrospinal fluid, CSF. In the space between the arachnoid and pia mater, the subarachnoid space, I float in a clear, colorless fluid called CSF. CSF is manufactured in my internal ventricles by the choroid plexus. It acts as a shock absorber, floating me so my heavy weight doesn't crush my own blood vessels. 3. The blood-brain barrier, BBB. My capillaries are lined with tightly packed cells that act as an ultra-strict border patrol. The BBB allows oxygen, glucose, and essential water-soluble molecules to cross easily. but it slams the door on bacteria, large toxins, and many medications, including some antibiotics and chemotherapy drugs. Common brain diseases. When my blood supply is interrupted, my electrical systems misfire, or my cushioning fluid gets trapped, severe neurological damage can occur. 1. Cerebrovascular accident, CVA, or stroke. When brain tissue dies due to a lack of blood flow, this falls into two main categories. Ischemic stroke. A blood clot blocks an artery supplying my tissue, starving my neurons of oxygen. Nursing action. If caught within a strict time window, thrombolytic clot-busting drugs like TPA can be given to dissolve the obstruction. Hemorrhagic stroke. A blood vessel ruptures and bleeds directly into my tissue spaces, creating pressure and depriving downstream cells of blood. 2. Increased intracranial pressure, ICP. Inside the rigid skull, three components exist in a delicate balance: brain tissue 80%, blood 10%, and CSF 10%. This is known as the Monro-Kelly doctrine. If one of these increases, such as bleeding from a head injury or a growing tumor, the pressure inside the skull, ICP, spikes dangerously. Nursing assessment. A classic late sign of dangerously high ICP is Cushing's triad: severe hypertension with a widening pulse pressure, bradycardia, slow heart rate, and irregular, shallow respirations. Image demonstrating the Monro-Kelly doctrine of intracranial pressure equilibrium. 3. Seizures. A sudden, uncontrolled surge of electrical activity between my neurons. It temporarily disrupts sensory processing, motor control, or consciousness. Critical nursing assessments. The NeuroCheck. As a nurse, assessing a patient's neurological status requires precision. Here are the tools you will use every day. Glasgow Coma Scale, GCS, a standardized scoring tool used to objectively gauge a patient's level of consciousness based on three criteria: eye-opening, verbal response, and motor response. The scores range from 3 to 15. Nursing rule of thumb: GCS of 8, we intubate. If a patient scores an 8 or less, they are comatose and cannot protect their own airway. Perla, testing cranial nerves. 2. Optic, and 3. Oculomotor, by shining a light into the eyes. Pupils should be pupils equal, round, reactive to light and accommodation. A sluggish or fixed dilated pupil can indicate severe brain compression or injury. Aphasia, speech disturbances. If a stroke damages my speech areas, the patient will display specific language deficits. Expressive, Broca's, aphasia. The patient understands everything said to them, but they cannot physically formulate the words to reply. It is incredibly frustrating for them. Receptive, Wernicke's, aphasia. The patient can physically speak fluently, but the words they choose don't make any sense, word salad, and they cannot comprehend spoken language.